Good morning and good afternoon. If you're on the West Coast, it's, well, no, actually, it's noon on the West Coast now. Welcome to our webinar on how homeopathy is healing Lyme and autism. I am going to jump right into my slides as soon as we just take care of a little bit of housekeeping. If you have other things that are taking your bandwidth, if somebody is streaming a movie in your house, or you've got a number of windows open in your browser, close as many of those as you can. Of course, don't close this one. That way you should have the best viewing experience because you'll free up as much of your bandwidth as you can. I'm Cindy Griffin, and I'm going to get started here. I want to introduce you to our other practitioners. I'm one of 4 practitioners at Homeopathy Center of Houston. That's me in the upper left-hand corner of your screen. Next to me is Linda Lanham, who is also the co-owner of the practice. And in the lower left, we have Julie Adams. And in the lower right, we have Lynn DeMartini. And we all come to this with various backgrounds and qualifications, but we all have had many, many years of working with homeopathy, many years of working with autism, and unfortunately, a number of years when we have had people with Lyme and autism, as well as people who have Lyme without autism. So we've had a lot of experience in a lot of different areas. Okay, we are going to jump into this. I want to get going because we're going to cover some information that you may not be particularly familiar with. I am going to take myself off the screen here so that I'm not going to be a distraction. So we have been in business. This is actually our 15th year in business. So that's pretty exciting for us. It's my 20th year of practice, but as Homeopathy Center of Houston, we started the business in 2003. So this is our 15th anniversary. So we're excited that we are still around and still doing what we've done for many, many years. And we're happy to share the information that we have with you. First of all, of course, we have to have our legalese. Homeopathy is a 200-year-old practice. So the principles have been around for over 200 years, and it's based on the principles of like treats like, and the use of tiny infinitesimal doses or nanodoses in order to accomplish detoxification, health, and healing support. And of course, homeopathic science is not generally accepted by modern conventional medicine and science. And any of the claims in here have not been verified by the FDA. But we are professional homeopaths. We're not medical doctors. And homeopathy is an alternative health modality, but not intended as a replacement for conventional medicine. If you have a problem, you need to call your doctor if you've got a medical issue that needs help. And of course, any information in here is for educational and marketing purposes. This is not an individualized consult, and this isn't a do-it-yourself approach. So please don't construe this as being any sort of medical advice or do-it-yourself advice. If you need medical help, you need to consult a medical doctor. And as I said, homeopathy is not intended as a replacement for conventional medicine where it has its place. Certainly, if there is a life problem, a life-threatening problem, then you need to call your doctor. So why would we even consider talking about Lyme disease in children with autism? Let me show you a few statistics here. This is, since 1996, the CDC's chart of both confirmed and probable cases of Lyme. And you can see they were a little higher in 2009, which also was a year when a flu vaccine was introduced that created a lot of problems for a lot of people. We have also another chart here that to me is very alarming. If you look, the ages are at the bottom when people are diagnosed with Lyme disease, and the highest numbers are actually age 5. Now, to me, that's very frightening, but it also makes a lot of sense because think about it. Kids are outside, they're rolling around in the grass. If you live in a wooded area, they run around in the woods. They can pick up ticks easily. They, hang all over the pets. They love on them. They fall on top of them. So they are going to be at a slightly greater risk than our adults because we typically don't go rolling around in the dirt and running through the woods too much. But then again, you also notice that between about ages 40 and 60, you also have a very high prevalence, which makes sense. Those are, we're the baby boomers and the just past the baby boomers. So it's going to be a little bit of an issue. Going to be more outdoorsy and that sort of thing. The prevalence in autism is based on pretty much clinical reports, but 20 to 30% of children who have been diagnosed with autism also test positive for Lyme. Now, you also have to understand that Lyme and autism is not being talked about very much right now. And so most kids with autism aren't being tested for it. But the ones who are definitely coming up with 20 to 30% of them also having a co-indication of Lyme. And clinicians are actually reporting anywhere between 20 and 90% of their clients also with autism also are showing positive for Lyme. So Lyme literate practitioners are definitely seeing that it is there in a very high number of kids with autism. And by the CDC's own statements, Lyme is definitely underdiagnosed, partly because the Lyme tests are very unreliable. If you get tested too early after the onset, then there's really only about a 50-50 chance, maybe even a 60-40 chance that it will be a false negative. And of course, they tell you, in the first few days to few weeks after you get a tick bite is when you should be seeking treatment, but you can't get treatment without a positive test. But until you actually have symptoms, typically you're going to have a throw of the dice chance of whether or not it will show up in the testing. And children with autism are immune compromised. So why in the world would they not be susceptible? So how is it that kids get Lyme disease? Well, they get Lyme disease the same way that adults do. Their pets get ticks, or they're out in the woods, or they're, going camping, and they pick up a tick. And you can see that little cartoon. We show a little bullseye rash, and the doctor's saying, yep, look at your little dog there. He's got some ticks, and guess what? One of them bit you, and now you have Lyme disease. So kids can get it very definitely from a tick bite, but it also can be transmitted in utero from mother to child. And a lot of our kids with autism, we are finding that later on, or maybe before we even work with them, that one or both of the parents have Lyme disease and the child has Lyme disease, even though they never had a tick bite, which tells us it can definitely be transmitted from mother to child. And there are some current concerns being voiced that it may actually be entering through some other vectors, such as mosquitoes. So what are some of the common early Lyme symptoms? And we get these from the non-autistic sufferers because they can tell us what's going on. So these come from adults and children who have been diagnosed with Lyme but don't necessarily have autism. But keep these in mind because you are going to see an overlap in just a minute. So physiologically, it's quite possible to have fever, headaches, and they're quite often of a migraine level of headache. Fatigue is a big problem with Lyme, like fatigue that lands you in bed and you can't move. Muscle and joint pain, bullseye rash, but the bullseye rash is not always necessarily there. And they also can have a lot of different forms, so they're a little bit difficult to diagnose. Some of them can have a crusty center where the tick left, where the bite actually was. Some of them can show up in other areas where you may not have had the bite. You can have multiple rashes. Some of them aren't really a bullseye. They're just reddened, circular or oval shaped reddened areas. So the bullseye rash isn't necessarily, if it hasn't shown up, that doesn't necessarily mean that Lyme is not present. But certainly if there has been a tick bite, you would want to have it checked out. Now, the mental and emotional symptoms, these are the kinds of things that often are going to overlap with our kids with autism. As I describe these, you may think, oh my goodness, this is my child. Now, autism without Lyme can have some of these, but Lyme can also make them worse. So emotional lability or moodiness, so mood swings, brain fog, inability to concentrate, withdrawal from life. I mean, and a lot of that is because of hypersensitivity to sound or light or touch. And if there's a history of strep, that's going to make it even worse. In fact, it may be one of the largest bases for hypersensitivity. We have found that to be true. But then if you add Lyme on top of it, then that just skyrockets. Depression, even OCD can be a part of it. And then later symptoms, with or without antibiotic treatment that can come on. In the physiological, you can have brain inflammation, which can lead to all kinds of neurological issues, movement disorders, numbness, tingling, or pain in, different parts of the body. Most of the time it's noticed first in the extremities, in the hands and feet. Bell's palsy, which is a typically one-sided facial paralysis that comes on, is very common. That can even happen early with Lyme in some cases, especially if the bite is in the head or neck area. We've noticed that's more prevalent. It can mimic MS or myasthenia gravis, even Parkinson's disease. You can see tremors, you can see all kinds of things that a lot of people who are diagnosed with some of these disorders may actually have Lyme and may find out later. And even seizures can be a part of it, especially if there is significant brain inflammation. And there can be heart damage that causes heart palpitations, as well as down the road arthritis of the level of rheumatoid arthritis. Mental problems such as memory loss, disordered speech, which can go with the memory. You can't find the words, or maybe you just can't put your words together. And that goes with the brain fog. Dementia-like syndromes. A lot of people look very crazy. And of course, then they get told that it's all in their head, so they become depressed. But there is depression and emotional distress that is actually a physiological entity with Lyme. And mental anguish over being told it's all in your head when actually it was in the head of that tick that bit you. Here are some of the overlapping symptoms that we see in autism. And these are things that parents can observe in their kids because the kids can't tell us. Here we go. Neurological problems such as movement disorders, numbness, tingling, and pain, which will often be expressed by the kids shaking hands or rubbing them, or rubbing or shaking their feet, or maybe not wanting to walk some days and being fine others. Bell's palsy can happen in autism. We have fortunately not seen that, but I have heard of cases in other practices. And again, it can mimic MS or myasthenia gravis or Parkinson's, like tremors and movements and lack of coordination. Seizures can happen. Arthritic type joint swelling. Often in our kids with autism, that may show up more in the hands and the feet rather than the large joints. But if we see that, we certainly have good reason to at least have it in the back of our mind that we could be working with somebody who might have Lyme disease as well as autism. And of course, the mental and emotional behaviors, there is a lot of overlap with other things in autism that may or may not be related to Lyme, but emotional mood swings, the brain fog, the inability to concentrate, and with our kids with autism, sometimes if that is not also coupled with perhaps giggly, drunken behavior, which would indicate a high level of dysbiosis, or maybe they've got issues with just not sleeping through the night, waking between 2 and 4 in the morning. If we see brain fog or kind of spaciness in conjunction with those, more often that's going to be related to yeast or candida, or however you want to talk about it, dysbiosis. But they also tend to withdraw because of their hypersensitivities to sound and light and touch. And again, if there is a history or high levels of strep present, then those things are going to be there even without Lyme, but the Lyme can make them worse. And of course, many of our kids with autism have either no speech or it's very disordered speech. If they do have it, it doesn't make a lot of sense always. So some of the things we just covered, but other things that we, of course, can look for in autism that might indicate Lyme are the kids not being able to talk. So, we have to depend on the parents of observing and relating to us what they see. But headaches, most of the time with autism, head banging is going to come from severe gut pain. But we have had kids who have Lyme who also have headaches. And some of them have had enough language to be able to tell their parents that their heads are hurting. So when we see that, that's not always real common just in autism. So we certainly put that as, check that off on our checklist as something to raise our eyebrows about, that Lyme could be present. Now, kids who have just been absolute non-responders to almost every approach biomedically, whether alternative, whether it's supplements, or whether it is a drug-based biomedical treatment for autism, we need to consider that Lyme may be a picture, although parasites, especially if it's in conjunction with playing with their feces or smearing, or if it's everything seems worse with moon cycles, then we suspect some other parasites. But it's also quite frequent that the non-responders are actually suffering with Lyme. And if we've got kids with autism that are just completely without energy, now they're very sick children, but most of the time they have enough energy that they're expressing it almost through hyperactivity. But where we see a child who is just super fatigued, of course, we get a good history. So we don't just assume this out of nowhere. But it's definitely something we look at when our autistic kids just are lethargic and don't seem to have any energy. And then if it's coupled with swollen joints, we have to consider it. And of course, this hypersensitivity to sound, light, touch, and other external stimuli, just, they feel like they're in Walmart on a, Christmas Eve kind of thing all the time. They're in fight or flight mode. Sometimes that can be an indicator of Lyme. But when kids are doing our approach and they have absolute opposite responses to what most of our kids would show us, so we would normally expect, then, especially if it goes on month after month for several months and we're just scratching our heads, all of a sudden the light bulb goes on, and that's when we start suspecting that there may be Lyme, and then we need to switch gears a little bit. So I want to talk to you about one of our kids, we'll call him Jimmy, who came to us with autism. He had done all kinds of biomedical treatments. He'd done chelation, which is a means of detoxifying for heavy metals. He had done IVIG. He had had antifungal drugs, antibiotics, and antiviral drugs. Pretty much, if it was out there in the biomedical treatment of autism world, he had done it. He had sleep difficulties. He had difficulty falling asleep. And then even if he did go to sleep, he might wake up in the night, but even if he was asleep, it was obvious that he wasn't sleeping soundly. He would flip and flop and talk in his sleep a little bit. Just not a good restful sleep ever. And we tried to get things settled down with him, and instead he got worse. So the remedies that we would use that would not be provocative at all, or shouldn't be in most kids, whatever it was, it seemed to get worse. His sleep got worse, his anger got worse, his fatigue got worse because of course he wasn't sleeping well, and he had diarrhea, and even that got worse. And we started scratching our heads about 3 or 4 months in. It was like, what are we missing? So we started using some remedies that we have found and other clinicians have found useful, specifically for sufferers of Lyme disease. And when we first started it, there was what we call a homeopathic aggravation. Things got a little worse before they got better. But they did start getting better. So we had a feeling we might have been on the right track. Fairly immediately, the diarrhea went almost entirely away, and we started seeing formed stools. Sleep disturbances didn't seem to fit those that were normal for candida or parasites. We didn't see the moon cycle worsening. We didn't really see waking at 2 to 4 in the morning. He wasn't giggly or drunk acting. He just never really slept soundly and had such difficulty falling asleep, which of course didn't get better until we started using some of these remedies that are indicated for a lot of the symptoms of tick-borne diseases. And after a few months, by focusing fairly heavily on what we assumed were probably tick-borne illnesses, we started seeing improvements in other behaviors. And what's really cool is one of the first things that came around, of course, the sleep. When everybody is sleeping, everybody's happier in the whole household. So that was great. And speech actually started coming along. He had had 1 or 2 words, but he started using 2 and 3 together, and they were much more meaningful. His emotional moods started really improving, and those were a blessing. There was much less anger and aggression. There were more days when he seemed to be contented. There were some stems that more likely were actually ticks. They may have been little absent seizures. The parents did not choose to test for these, but they simply got better over time. Focus became better and better on tasks. And over about a 3-year period, he went from full-blown, almost nonverbal autism to catching up in school and catching up socially. So he really moved along. So our homeopathic approach, it is not a do-it-yourself method, and I won't kid you. You're not going to be able to watch a few webinars and work with your child with a handful of homeopathic remedies probably and eliminate autism nor Lyme, much less Lyme in autism. But with our oversight and with professional remedies, which I know for a fact you cannot just go out and buy, they are practitioner-only remedies, we have been able to put together very individualized approaches such that virtually any chronic illness can be reversed to restore health. And our approach lets the body literally turn back the hands of time. We can turn the tables around and start putting the brakes on first, and then we start moving backwards by detoxification of various things, whether it's heavy metals, whether it's pathogens, or whether it's just leftovers from old injuries, surgeries, that sort of thing. We work our way backwards through time, through each person's individual history. So that alone makes it individualized because no people have the same history. And we support all the facets of healing and detoxification. So we've got to be quite flexible because none of us have a crystal ball. We don't know exactly how every client is going to respond to every month's approach, whatever we're detoxing that month. But we have a multi-pronged and completely non-toxic approach using homeopathic remedies of several different varieties under the umbrella of homeopathy. And we put together a totally individual package. And it requires working with the natural healing abilities instead of against a germ by killing germs. And honestly, most drugs even act against our built-in natural healing abilities. They work to try to kill germs, and that alone can create its own problems because the upcoming pictures are from a book where we learned a great deal about Lyme disease as well as other pathogens. Dr. Lyda Matman was a microbiology professor. She was, I believe, at University of Kansas. She literally was seen carrying a microscope under her arm, running around campus all the time. She was totally and completely focused on her students and on learning everything she could to teach them about microbiology. And she published 3 editions of this book before she died. She was actually nominated for a Nobel Prize for her work in finding these cell wall deficient forms, which she referred to as stealth pathogens. And that is because antibiotics, as well as some other drugs, strip away the outer cell wall, which is what she uses and what all medicine uses to find and discover in lab testing what organisms, in particular bacterial organisms, are present. They use stains that stain the cell wall. But when you give an antibiotic, it peels away the cell wall. And Dr. Matman proved this. And then she went on further in her research to prove that that did not kill those bacterial organisms. In fact, they were still there, but now you can't see them because the standard staining techniques that are still in use today don't show up because there's no cell wall to stain. And she studied this and she discovered that these pathogens continue to live and they actually become much more virulent because now bacteria can actually wrap their DNA into the DNA of viruses, which means they can now go places they never could go before antibiotics created a new, what we now call today, resistant or superbug. So Borrelia, which is the Borrelia burgdorferi, is what causes Lyme disease. And scientists, these are electron microscope views of Borrelia. They actually show up in different forms. This one looks a little bit like beads on a string, which is one of the reasons I chose my little pearl necklace today, just to remind you of the beads on a string that is only one form of Borrelia. These are one of the reasons, these different forms are why it's so difficult to diagnose Lyme through lab testing, because it changes, it morphs. It can look like what they call an L-body cyst, which is then attached to filaments. They can grow these growth colonies that have almost tentacles that go out. and can literally take root in your cells. And they can also look like these filaments. So really, it is a great pretender. Lyme is a great pretender, both from the way that it looks in lab testing, as far as the germ, if you will, but also the symptoms that it causes. So that's why frequently they have to go to higher and higher dosages and switch around on different antibiotics, because basically they're chasing their tails, except they're really chasing the Lyme tail. So all these different things, these are different forms that Lyme can take, that Borrelia can take. These were actually out of Dr. Mattman's book. So she was around late enough in life that the electron microscope was becoming quite a tool. And she observed these, and these were the pictures that she showed. And she basically said, you're just chasing them with the antibiotics. And just as a sidebar note, I mentioned that she was nominated for a Nobel Prize in research, and she did not get that prize because quite literally she would have destroyed the use of antibiotics, because antibiotics do this with many, many pathogens. So she got passed over basically because she had proven that antibiotics cause bacterial organisms to change into something similar to a virus without a cell wall. So now they can become shapeshifters, to use a science fiction term, and become resistant to further antibiotic or other drug treatments. So really, in her estimation, drugs may very well have been the stimulus for the Lyme disease organisms to be changing form. However, there's good news, and that's what we're here for. Homeopathy cannot create a homeopathy-resistant superbug. We're not trying to kill the bug. We're not trying to peel its outer layer off. We simply are trying to support and stimulate the body's own supportive healing systems and the natural systems built into the immune system to fight the disease in a natural means, instead of creating new variants of the disease pathogens that become resistant to treatment, which seems to be what drugs are doing. They've done it with so many other organisms. That's why there are drug-resistant forms that cause pneumonia. There are drug-resistant forms now coming out in urinary tract infections. But homeopathy is not resisted by the bugs because we're not fighting bugs. We're making the you who is sick healthier in order to naturally eliminate them. And that elimination can come in different forms. It can be through sweat or fevers, or sweat with or without a fever, because the sweat is carrying out pathogens and toxins. It can include vomiting occasionally, and no, we don't make people vomit, but some of the bad things that they're getting rid of, sometimes that's the best way the body can get rid of them. Elimination through urine and stool is, of course, always preferable, although sweat's not too bad to handle. We help support the detoxification mechanisms, and oftentimes there will actually just be a spontaneous heavy metal or chemical or other toxins that are released, and people report things like their sweat smells funny, or their urine smells of chemicals, or their stools. And that also is going to help the body eliminate other pathogens, bacteria and viruses. We help by reducing and balancing inflammation so that the immune system can use healthy inflammation, the temporary generating of heat, in generalized forms like fevers, or localized forms like a sore throat or a mild rash, briefly instead of chronically, to get rid of the pathogens. So we're promoting the healing process in numerous different ways with homeopathy. And really, we don't call those shots. The immune system does. We just know that we have tools that will help support it and try to drive it to eliminate the things that cause illness. There is a definite natural order to healing, and we try to observe that as much as we can with our clients. The first thing we want to do is boost the excretion. We want to clear out the exit ramps. So we do start by supporting the urinary tract, the digestive and elimination pathways. And once natural elimination routes are functioning better, now a lot of times just a very slow, natural, gentle detoxification and tonification, so tonifying or getting healthier, is going to follow just very naturally from our starting to support those detox routes. Because once we start getting the bad stuff going out through the stool and the urine, now the lymphatic system is cleaner and the cells are able to start pushing toxins out into it, where if the lymphatics and all of the things that wash around our cells are very toxic and very germ-laden, then the cells can't clear themselves and they can't get healthier. So as we start detoxifying, we know that we have to do a certain amount of that before recovery can ever occur. And then natural recovery starts occurring when the body is sufficiently unburdened to allow the cells to actually start the regeneration and rejuvenation process. And we also use remedies that support that. So once those toxin levels and the burden on the immune system is released and reduced, now the immune system itself can now tackle viruses, bacteria, fungal overgrowth, and start rebalancing and moving towards actual health. Now, I'd like to share another autism case that has sort of a surprise twist at the end. We'll call her Alice. Alice's parents had spared no expense. They had done every biomedical treatment. They'd even gone in debt in order to provide these treatments. They, of course, also did some ABA and that kind of thing, some behavioral therapies and so forth. And with a few of the things, they might get a little bit of improvement here or there, but a lot of times it was temporary and it would fall away over time, especially things that were drug related or maybe supplements that worked for a while, and then they would quit working and they'd have to move on to something else. Unfortunately, the vast majority actually increased her symptoms. At age 2, she was actually diagnosed. Her coordination was so bad that she was actually diagnosed as having a form of mild cerebral palsy, as well as a seizure disorder, and there was absolutely no attempts at new language. And this is at age 2, when she should have had at least 1 or 2 words, mama, dada, something. They had done chelation, they had done hyperbaric treatments, they had done antibiotics, antifungals, antivirals, anti-everything, and almost all of them, they got side effects, but mostly they didn't see any positives. So they got negative results, and she was getting worse and worse. By 5 years old, she was still in diapers. She was smearing her feces on a regular basis, and especially during moon, full moon or new moon, and there still was virtually no speech. And then about at 5.5, the mom started doing a very heavy supplementation and dietary program, which was one of the first times that they started seeing some more consistent gains, but it still was plateauing. And some of the supplements were really hard to get down her, and it was difficult. At about 6.5, the mom had been talking to other moms and word of mouth. By the time Alice was 6 years, 10 months old, mom decided, the heck with this, we're going to quit everything else. And of course, you know, with doctors and practitioners' oversight, she tapered her off. And at 6 years, 10 months, started with us. And the mom said, Homeopathy Center of Houston ended up being the most healing of all the treatments we've done. I wish that we had started with them and could have avoided all the anguish of invasive treatments and years of painful gut problems, because a lot of the treatments that they had done actually created some major gut dysbiosis, as well as just gut pain because of the side effects. Now, at nearly 7, Alice still was not doing basic pre-K skills. And again, this was just before she came to us. She couldn't do anything in any academic area. She couldn't do puzzles. She was completely confused if you gave more than a one-step instruction. She couldn't sing songs. She couldn't identify letters or numbers. And Mom had literally said, I was just totally worried that she was never going to be able to learn anything, not to mention talk. A year later, working with us, of course, we had to clean up a lot of things. We had to clean up a lot of the drug residue that was left from even the biomedical interventions. And then we started working back through the vaccine history and just cleansing and toning everything up. And almost exactly a year to the date on our program, she was tested a year later. She started reading 5 months into our program. I don't want to skip over that. It was only 5 months into it that she started reading easy readers on her own. That was pretty cool. So obviously we got some speech very early on. She started reading these easy readers at 5 months. A year later, she was actually working at a first grade level in reading, in math. She was having two-way interactive conversations, becoming very social, almost too sociable, getting in trouble at school for visiting with the other kids while teacher was trying to talk. She was able to follow verbal instructions with several steps, started playing appropriately with toys instead of just lining them up, which had never, ever happened before. And she even started watching a TV show, a little cartoon program, and was actually picking up some Spanish on her own and having a lot of fun with it and confusing Mom and Dad. And so shortly after that, Mom basically proclaimed that she was recovered. I now consider her recovered. She realized that when one day she was working in the kitchen and Alice came in and said, Mommy, come play with me outside because I don't have any friends here to play with. And clearly she had had friends at school that she played with, so she'd had the experience, and she was being extremely articulate. And Mom said this was a verbatim quote out of Alice. She had even started telling knock-knock jokes, and she was even telling them correctly, so she was better at that than I am now. And after just over a year with us, she was able to eat almost anything except dairy, which, of course, we don't recommend dairy and to anyone. But when we're working with our kids, their guts usually can't handle casein, which is in dairy, or gluten, which is in many, many grains, wheat being the one we think of first, but many other grains as well. But she was able to actually eat some grains again. And actually, in hindsight, the dairy that the mom noticed was the biggest problem probably was because it was yogurt, and it may have been the strep thermophilus, which if we have kids with high strep levels, often yogurt and some probiotics, which contain strep thermophilus, can actually cause irritability, and that's exactly what yogurt did for this little girl. The mom's words when she was finished was, our life was dominated by poor health, therapists, special schools, doctor's offices, labs, IV needles, tons of supplements, and dietary restrictions. And it has completely changed. We seldom need healthcare help, and when they did, they came to us. I'm so thankful to HCH for what they've done for my child and all of us. And this is the part I want you to listen to, parents. People need to know that autism is treatable and kids can and do recover. And Alice is one example. But we're not quite finished with this success story. Roughly a year after leaving HCH with Alice, Alice's mom was tested for some new health concerns that came up for her. And we had actually worked with the mom. And she was diagnosed as being in very late stage Lyme disease, meaning she was largely over it. But we had worked with her and a lot of the symptoms had gone away. And this just was something that crept back. So she got herself tested. And while she was doing it, she went ahead and tested Alice and her sister. And Alice demonstrated antibodies, that clearly demonstrated that she had previously overcome Lyme disease. And our practitioner had no idea that Lyme disease was present at all the entire time that we worked with Alice. And so there was never any specific focus made on Lyme disease in particular. So even without knowing it, we were able to, we were working with a child who had both Lyme and autism, and both went away. So this is one of our really fun stories. Obviously, both autism and Lyme disease can be very responsive to our method. We pretty much supported the detox pathways. We did some specific cleanups in her system. We supported the immune responses. And even without a diagnosis of Lyme, but by following the autism-related symptoms, the body itself recovered in the process from Lyme as well as the autism. Now, it's not just in autism. I mean, we're known for our work in autism, but we are a general practice. We take all comers. We work not just with autism, not just with Lyme. And age is really not a factor. I mean, I'm 62 years old, and when I catch a bug, I use homeopathy. We have clients who are adults who came to us for all kinds of chronic issues, from menopause issues to, chronic Lyme, to all kinds of problems in between, digestive problems, respiratory problems, all kinds of chronic issues are responsive to our program, and all ages. So we work with kids and adults, and the only difference between younger and older is the older you are, the longer a timeline you have. So we have to work back through more layers. So it does take a little longer, and we may not be able to clear a layer of an event in your history that contributes to your illness, but about every 4 to 5 weeks if you're older. Where with little kids, their metabolism is faster. We can sometimes clear things every 3 to 4 weeks. So that does slow it down a little bit with the older ones. But it does not mean that it won't work. It just takes a little longer. And anything worth doing in life takes time. Healing is no exception. We have had successes with adults with Lyme only, not with autism. We've had nearly 200 children with autism fully recover, and frankly, we don't know what percentage of those may have also had Lyme, but we know of several cases that did, because only a few parents bother to run the tests. But we have had a few parents run the test for Lyme and shown that their kids were positive, and they still made progress. We truly don't know how many, like Alice, may have had both Lyme and autism without our knowledge, and yet they still get better, with some recovering fully, like Alice did. So that's exciting. One more final case, which is really a twofer. It's actually 2 cases because it was a couple in their 40s. They'd been very active outdoor types. They had both gotten tick bites during some outdoor activities. I believe it was camping. I didn't find that in my notes, and I apologize. And both of them developed Lyme disease. One had actually had a bullseye rash. The other had not, but they both tested positive for Lyme, and they both had symptoms. They underwent long-term antibiotic treatment before coming to us for many, many, many months, and they did feel somewhat better. But among other things, their gut flora was just wiped out from the antibiotics. The good guys were dead and the bad guys were overcoming. They had sugar cravings from that. And after a few months off of the antibiotic regimens, they started developing there's really not a good name for it because it's very controversial. Some called it post-Lyme syndrome or post-treatment Lyme syndrome. Some call it chronic Lyme disease. Either way, the Lyme symptoms also were returning. So they looked for our help because they'd already done the antibiotic approach, and clearly it didn't get rid of the disease. So they wanted to try something different. And it was a long haul, but it was definitely worth it. They both worked with one of our homeopaths for several years, and they've had ongoing improvements with a few ups and downs. But after a few years, which of course it slowed down because we had to work around jobs and travel for work and travel for fun, but they have had improvements, and those improvements have remained in place for them across the board, except for every now and then a little return of fatigue, or they might have a little candida crop up around the holidays. Don't we all? You know, sugar is under our noses, so we eat it, and that feeds the dysbiotic bad guys in the gut. So we do work with them occasionally, but we find that their returning problems almost always have actually been related more to side effects of their earlier treatments than to Lyme, other than maybe some of the fatigue. But all of this to say, everything worth doing is worth taking the time and the energy and the investment to do. The investment of time and energy, and yes, the financial investment. But what I want you to know is that whether your child has autism with or without Lyme, please seek somebody who is Lyme literate, who is autism literate, and never, never, never give up, and I would add, on helping your child with autism. It is a process. Natural healing is always a process. Detoxification is a process. And it's not always a perfect, upward curve with no bumps in the road. I'm not going to pull wool over your eyes. There are times when sometimes things get a little worse, but it's typically very temporary. It can last a few hours to a few days. Occasionally, if we have something that's really locked in like Lyme, yes, it may take us weeks to months to start finding all of the answers and getting a global improvement, but you still find these little snippets, these little windows of hope that open up and that are doing well, where your child maybe spurts out with a word that they never used before appropriately, or maybe you get better eye contact. There are little signs along the way that good things are happening inside, but it takes time to get enough of the bad stuff out to be able to get the body able to then start healing itself. And that's where you get these global, ongoing, and long-term improvements. But with homeopathy, once we get those improvements, they tend to stick around. So please don't give up on your child's autism. Look for people who know how to work with autism. If you get on the internet, you will find videos of parents who have used different homeopaths all over the world, and their kids improve. Homeopathy offers real hope for autism. It offers real hope for Lyme disease. So homeopathy truly is a healing modality, and all true healing will be permanent. So homeopathy is definitely healing Lyme, even in autism. I hope you've enjoyed our presentation. I hope you've gotten some nuggets of understanding about what you may be seeing with yourself or your child. I hope that you will give us a call. I'm going to put up here a link where if you are ready to start healing now for your child, you can just click on that link. We do consultations by phone all over the world. And if you are interested in help for your child, or maybe you have Lyme disease, it's a slightly shorter form if you don't have autism than the one that I've put up here. But I do want you to feel free to give us a call. I want you to, by all means, check out our website, which is www.homeopathyhouston.com. We are always happy to answer your questions. We are here to help you. We are here to help your child. We will answer your questions. Just give us a call, or if you're ready to just jump in, if this sounds like what you want to start doing with your child or perhaps with yourself, I hope that you'll just click on the link and fill out the paperwork. If you're an adult, feel free to call our office and we'll send you the link for the adults. But this was a focus on Lyme in autism, so I want to give you the right link for that for your child with autism. I hope that you'll come back and listen to this again if you feel like you got good information. Please, please, you will get the replay link in a few days. And when you get that, I hope that you will share it with other people. And I hope that we will be able to help you or help your child. Thank you so much for your time. And I hope that we see you very soon. If we can help you, give us a call.